Today, Dr. Barth and I would like to help you understand the importance of having a supportive care team and share ways in which to effectively communicate with your other medical providers. In general, when we feel fully supported and empowered in our health and life choices, we heal faster, we experience more happiness, and we get to gain greater confidence. Dr. Barth, as a physician with over 40 years of experience, what would you say are the most effective ways that a physician can support the health goals of a patient?
So what I've learned is that patients know their own bodies the best. They are in touch with what's going on with them 24/7. I'm just somebody coming in, asking questions, listening. Listening's very important, listening to what they have to say, listening to their experience, but the bottom line is the patient knows best. The patient knows how he or she reacts to a certain medication, to exercise, to food. I try as a physician to listen to the patient, to ask the right questions, and that way I gather the information that I need to support them.
So what should a patient or one of our members look for when they are choosing their physician or healthcare team?
Yes, so what I look for in somebody who's going to support me to be as healthy as I can be is a healthcare provider who can listen, who can understand where I'm coming from, who's willing to be open-minded to other points of view, to other ways of experiencing things, to other possibilities, rather than coming with a certain agenda. Somebody who doesn't think they know everything better than I do, somebody who's open-minded and kind. Kind with their time, willing to spend a little extra time, and willing to understand where I'm coming from.
What impact do you believe a physician can have on a person when they do listen to a member?
So I know for me, when I feel listened to, I'm much more likely to take in the information that's shared with me. And as a healthcare provider, a physician or a physician's assistant or a nurse practitioner, they have a lot of knowledge. They have research behind them. They have a lot of education. And if I'm open to receiving that, they can really help guide me and support me on the path that I've chosen for myself.
If one of our members is not feeling supported by their current physician or care team, and that could be to do with any part of their care, what strategies do you feel they might try for some more success there?
So the first thing I do is I approach it a little bit sideways. I would ask a question such as, let's say, having to do with cannabis. Do you have any patients who've used cannabis? I've heard it might be beneficial. I start with generalizations rather than putting the physician on the spot. I'll start with things like, I've read about this, I've heard about this, people have talked to me about this, and I'll watch the physician. I'll just look and see, is he looking down? Is he writing notes while I'm talking? Is she not paying attention? Does she get a kind of furrowed, angry look on her face? Or is there some kind of openness and friendliness about it? If I notice that there's a little bit of openness, maybe I might start exploring a little further and sharing a little bit of information about what I know. Keep watching the physician to see if they're open or not. There's no point in pushing somebody to change their mind, but it's really helpful to share from your own point of view and keep following the thread.
So if a member does feel comfortable with their physician, but the physician may not know a lot about medical cannabis, what's some basic information the member could share with them?
As a member, it's important for you to know that physicians aren't necessarily educated about cannabis in medical school or afterwards. So if they're open to it, you can start sharing with them your knowledge, what you've learned and where you learned it. Did you read? Did you watch a video? Did you talk to friends? All of that can be shared with the physician. Then you might go a step further and ask the physician if he or she knows that there's different modalities. You don't have to smoke it, for example. You can use salves or tinctures. Just share a little bit of your own knowledge to open the physician's mind to the possibility that it might be useful for you as a member or other members. So physicians are just like you. They're human beings with their knowledge and no knowledge, hopefully open-minded to new possibilities, but they also have preconceptions about cannabis, just like many people out there. They're no different. And so those preconceptions, such as, will it be addictive to my patient? Will it interfere with the medications that I give to them? These are things that physicians can educate themselves about, just in the same way that you did, the same questions they have, and the same places that they can go and look and find answers, just like you did.
We invite you to peruse the printable handout that we've prepared. It includes some of the cannabis knowledge that you've already gained, as well as some more technical information on the endocannabinoid system, specific cannabinoids, and some of their uses for specific symptoms and conditions. You may find this useful also to share with your physician or other care providers. And you can also point them toward our research library, send them to any of the articles that we link to, or simply put them directly in touch with us. We're committed to helping facilitate the best possible care for our members so that you can always receive the best possible outcomes. And lastly, just remember, your body and mind are the most powerful healers that you have. So surround yourself with those that support your goals and your choices.